Hello, Dr. John Dahlman, chiropractor. And the other day I got a phone call from a prospective patient, and the patient asked me, do we treat patients who have been in auto accidents? And the answer to that is absolutely yes. When you're in an auto accident, the forces of the two vehicles colliding has to be transmitted into something else. So what happens is that the force gets transmitted into your spinal structures, your ligaments and your tendons, and they can be disrupted through a whiplash type motion. And when you take and you look at a side view, let's say you're hit from behind, you cause a bending and a whipping back and forth and a bending of the spine. And so the spine goes through a motion back and forth, back and forth. And what can happen is that the ligaments and the supporting tissue can get stretched or torn even in many of the really more severe impacts. And chiropractors will analyze and examine the spine looking for these areas of soft tissue injury, and then we work towards correcting those injuries or returning a person to normal balance. Oftentimes, say in the cervical spine, the normal curve, this normal cervical curve that's like a C curve, gets disrupted, and a person ends up with a ramrod neck or a reversed curved neck. And that creates pressure onto the nerves that exit the lower cervical spine and onto the nerves that exit at the top of the cervical spine. And the lower cervical spine nerves go down into your arm. So quite frequently people will have shoulder complaints. They'll have numbness and tingling in their hands and their fingers. They'll have weakness in their hands and their fingers. And the nerves that come out of the upper cervical spine, they can go up into the head and the jaw. And so they'll get headaches, they'll get jaw complaints like TMJ pains, they'll get suboccipital headaches in the back of the neck. And when we analyze these people, we look for the disruption or the subluxations, which we've covered in previous videos. Sub means below, lux means energy. So it's a condition of low energy exiting the nerves, not allowing the muscle tissue and to control the movement at its optimal potential. Now, when you're in a car accident, it's not just your neck that gets whipped back and forth. Oftentimes, people will come in with mid-back pain, they'll come in with low back pain, and even sometimes on side collisions, they're whipped sideways and they ram into the door, and they'll have shoulder problems. And we can help treat all of these conditions at the chiropractic office. So if you've been in an accident, you're wondering, is there anything that a chiropractic office can do? We can help. Thank you.